Behind the design, metatarsal dome. This client needed a custom orthotic with the addition of a metatarsal dome for symptomatic forefoot pathologies. They chose the size and location of the dome via treatment-directed testing of a prefabricated metatarsal dome. The right dome was also customised with a cutout. The aim of this orthotic was to reduce the forefoot symptoms. They used the DOLA Custom Orthotic service. They used the metatarsal dome size and position section within the finishing section of the DOLA detailed prescription form. Key features of this selection included the treatment-directed testing of the metatarsal dome size, which was based on foot morphology and pathology location. They also selected the metatarsal dome position based on treatment-directed testing and reduction of symptoms. The left metatarsal dome was left in its standard shape, whereas the right metatarsal dome was customised with a cutout. Orthotip. A metatarsal dome is commonly used to influence forefoot pressures, forefoot function, and reduce forefoot symptoms. Common pathologies include Metatarsalgia or generalised forefoot pain, Capsulitis, neuritis, Bursitis, or Neuroma. Alternative prescription options include a metatarsal bar, a pour-on forefoot extension, or a customised EVA forefoot extension. Behind the design, metatarsal dome size. The DOLA prescription form has 4 size options listed below. They can be purchased for treatment-directed testing and are a slightly reduced height for clinical applications. Behind the design, metatarsal dome location. Key features of this selection include the prescription of the exact location for the metatarsal dome. The apex of the dome can be placed at a metatarsal head 1, 2, 3, 4, or 5, or in an ID space 1, 2, 2, 3, 3, 4, 4, 5. How to prescribe your metatarsal dome location. You can use the metatarsal dome script form by marking a single number for an apex or 2 numbers for an ID space, i.e. 2, 3. You can also mark it on your cast or scan or use a template. Behind the design, intrinsic metatarsal dome. This is an alternative prescription option, which involves the reduced fill or no fill between metatarsals 2 to 4 on your positive cast or in your CAD design. This will make an intrinsic metatarsal dome in the orthotic shell material. Caution: an intrinsic metatarsal dome in a poly or 3D printed shell cannot be easily adjusted or removed. If you plan for adjustment, please use an extrinsic addition of a metatarsal dome pad. In an EVA shell, the intrinsic dome can be ground away after removal of the top cover.